Hello and welcome. You're watching Friday's edition of COVID-19. I'm Min Sun-hee. A new cluster infection at a camping site in Gangwon province is raising much alarm as 6 of the 18 people who went there as a group this past weekend have tested positive for the virus so far. Testing and contact tracing are underway and authorities believe the number of infections may rise. Also, another group of Korean nationals has returned from Iraq and about 30 of them are reportedly showing symptoms of COVID-19. I have Hyun-Soa now with more on the pandemic and Kim Mo-kyun with related news about safety this summer. So there has been an increase in the number of infections here in Korea on this Friday.
Yes, Sunny, the number of new COVID-19 infections has doubled from yesterday, and also the number of imported cases has doubled as well, while local infections saw a rise to the double digits. So let's get a look at the details here. We have 36 new cases this Friday, which includes 22 imported cases and 14 local infections, raising the total to 14,305. One additional death has been reported, and that brings the death toll to 301 here in Korea. 821 people remain in quarantine, and 13,183 people have made a full recovery, with some 50 new recoveries. Now, let's take a look at how the situation developed over the past week. Last Friday, we had 41 cases, a little more than this Friday, and then we had that surge to the 3-digit figures, and that due to cases linked to a Russian ship, as well as South Korean nationals returning from Iraq last Friday. And as Sunny earlier mentioned, we also had some 70 South Korean nationals returning today, which means this figure is likely to surge on the weekend. Now let's move over to our map. We have 10 new cases in Gyeonggi-do province. That includes some 6 cases from abroad and 8 in the capital Seoul, as well as 2 here in Gangwon-do province. And these are all local infections, also some sporadically down in the southern parts of the country. Now, globally, the situation has not improved this week. This entire week, we had daily new infections above 200,000, and now the total stands at some 17.47 million cases, with more than 676,000 fatalities and around 10.9 million recoveries. Now, meanwhile, the U.S., Brazil, and India combined have more than 8.8 million cases, which means more than half of the entire world's cases here at 4.6 million, 2.6 million, and 1.6 million. And if the trend here in South Africa continues with some 11,000 new cases in the past 24 hours, it looks like South Africa might have more than 500,000 over the weekend. And moving to other places, here Peru with far over 400,000. Now we have another country from Latin America that's been added in the top 12 when it comes to the highest infections in the world, Colombia at 286,000 cases and more than 9,800 fatalities. Now those are the figures I have for now, but I'll be back with more updates after the government briefing. Back to you, Sunny.
Right, so thank you for that. I'll see you back at the desk. Now, summer vacation season is here in Korea, and so is COVID-19. The dilemma is, do we venture beyond the boundaries of our homes despite the presence of the pandemic, or do we stay within them, which is what many have been doing for the past few months and are in need of a taste of some form of normality to keep them going? To address this dilemma, I have Kim Mo-kyun here in the studio with me. Welcome, Mo-kyun.
Thank you.
Now, Mo-kyun, do you have any plans for this summer?
Well, I actually wanted to spend the summer overseas, but with the COVID-19 situation continuing all around the world, I kind of decided to scrap the plan, and I still don't know what I'm going to do for this vacation. Do you have any plans?
No, Mo-kyun, I too have yet to make up my mind, but I feel like I need to plan a change of scenery for my family just to keep them sane from all the restrictions that I've been imposing on them amid the pandemic. How are Koreans in general planning to spend the summer, Mo-kyun?
Well, according to a survey held by the Korea Transport Institute earlier this month, only 37.8% of respondents said that they will go on a vacation this summer, which is down nearly 4 percentage points when compared to last year. Of the more than 6,000 households who participated in the survey, a majority, 62% of respondents said they will not go on a vacation or they still haven't decided yet. When asked why, 76% of the respondents attributed the reason to concerns over COVID-19. And among those who decided to go on a vacation, a whopping 98% of them said that they will travel within the country. A separate survey held by Job Korea also showed that fewer people used their annual paid leaves this year. And according to the survey, more than 30% of office workers said they had taken fewer leaves than the year before, whereas only 16% said that they used more. And COVID-19 was attributed as the main reason for both groups of respondents. Those who used fewer leaves said the pandemic made it difficult to make appointments to go on trips, and those who took more days off said they did so when they felt mild symptoms to prevent the spread of the virus.
I see. And Mo-kyun, the government meanwhile has issued a separate list of safety guidelines for those with vacation plans this summer. Do tell us more.
Yes, the government stressed the need for the public to abide by social distancing measures to prevent another massive spread during the summer. Let's take a listen.
This is the first summer break since the COVID-19 outbreak began. I hope citizens will plan their vacations in a way that will protect their health and allow them to relax at the same time. I ask the public to abide by the 3 do's and 3 don'ts at all times.
The 3 do's include the following. Citizens should wear face masks indoors, minimize the time spent in restaurants and highway pit stops, and keep at least 1 to 2 meters social distance with others. As for the 3 don'ts, people shouldn't travel when they show any symptoms, they shouldn't visit crowded entertainment venues and tourist hotspots during crowded hours, and they should avoid physical contact with others that could expose themselves to droplets.
Mo-kyun, how are other countries seeking to prevent further spreads amid the summer vacation season?
Well, many European nations seem to be on high alert as they see usually a large number of tourists at this time of the year. Germany, for example, says it will screen travelers from 130 high-risk countries for COVID-19 upon their visit or re-entry to Germany beginning August 3rd. And those who tested positive for those who refused to get tested will be quarantined for 14 days.
Aber eben auch für alle anderen zu Hause entstehen.
That's why we have to try particularly now in the holiday season to prevent infections. Together as a society, we can prevent that as we did once before, breaking the wave and keeping the pandemic in check. We can do that again. I mainly rely on reason and not primarily on prohibitions.
Many countries have also begun mandating citizens to wear face masks. France is one example, and the rule applies not only when using public transportation, but also when visiting stores and banks. And those who fail to wear their masks will be fined around $160. Austria and Belgium also implemented similar measures requiring citizens to wear face masks in public places.
Which is understandable. Now, back here on the local front, the pandemic is also changing how people are planning their actual summer holiday. Mo-kyun, tell us more.
Well, like I've mentioned, many people are planning to spend their vacations this year locally, traveling within the country. And at the same time, they also want to keep social distancing. So non-face-to-face interactions have become a key important feature in the vacation season this year. Many vacation goers are booking villas with private swimming pools this summer instead of regular hotel rooms, with travelers preferring to spend time by themselves rather than open public spaces. Others are installing tents in their cars and spending a few days cooking and sleeping outdoors, often called chabak amongst Koreans. Others have turned their own homes into a vacation spot by installing entertainment devices such as karaoke machines, virtual golf simulators, and beam projectors to watch the latest movies.
It's quite inventive. All right, Mo-kyun, thank you very much for that report. Hope to see you back here soon.
Thank you.
Right, it's a little after 2 in the afternoon here in Korea, and we are poised to join the regular government briefing on COVID-19. In line with the opening of public facilities like museums and sports arenas like baseball stadiums, football fans are looking forward to cheering on their teams starting from this weekend. And just as is the case for baseball stadiums, football stadiums are to limit their accommodation of spectators to just 10% of their actual capacity as part of preventative measures in light of the pandemic. Meanwhile, health officials are calling on members of the public to partake in the Sit 1 Seat Apart campaign to further ensure their health outdoors. Whether you are at the movie theatre, sports stadium, In a plane or on a train, the practice is to sit 1 seat apart from those around you to allow for a healthy distance. Also on the subject of such campaigns, and in light of the summer vacation season, we have a list of guidelines by the government to ensure health while you're at the beach if you're seeking to seek refuge from the heat there. There are a list of 8 safety measures to be practiced, and the first calls for visitors to avoid beaches that are crowded, to perhaps take the less traveled road, as the poet Robert Frost would say. It's also advised for you to avoid gathering in large groups, and beach parasols, meanwhile, should be spaced 2 meters apart. The briefing has started. We'll come back to you afterwards.
First, here is Director Chung Eun-kyung with the briefing. Let us now begin our regular briefing for the COVID-19 situation here in South Korea. As of July 31st, today, we have a total of 14 new local infections and 22 new imported cases. The total number of confirmed cases now stands at 14,305. A total of 51 more people have been discharged, and the recovery rate stands at 92.16%, while 821 people are still in quarantine. The number of patients with severe or critical conditions stands at 12. We had 1 additional fatality as of yesterday. The death toll stands at 301. I extend my deepest condolences to the deceased and the members of the bereaved family. Let us now look at some updates on our domestic infections related to the Gangseo Central Daycare Center in Gangseogu District, Seoul City. We had also 1 additional case, and in total, the total number of cases stands at 30. And in relation to an office building in Gangnam-gu District, Seoul City, we have 1 additional case, and the total now has increased to 17. And in relation to a camping group in Hongcheon, Gangwon-do province, we also have 3 more family members being confirmed, and the total number of confirmed cases stands at 9. And as of today, we have 22 new imported cases. 12 of them have been reported at points of entry, while 10 others have been reported while on self-quarantine. And 15 of them were South Koreans and 7 of them were foreigners. And as for the countries, 4 were from the US, 1 from Mexico, 1 from Belarus, 1 from France, and also 10 from Uzbekistan, 2 from the Philippines, and Pakistan, Bangladesh, and Japan had 1 respectively. And the CDCH, we started from the KBO, the baseball games, starting from the 26th, and from tomorrow we will have the football games to open to the spectators. And before going to these games, all of the spectators need to book their tickets via online. They need to wear their face masks as well. And while they are watching the game, they need to wear face masks at all times. They must sit at designated places, and they cannot consume food within the seats. And also they need to refrain from chanting and shouting, which could increase the respiratory droplets to travel in air. And we also ask you to refrain from crowded places and enclosed places like pubs and restaurants and cafes after you have visited these sports stadiums. Yesterday, regarding the Hongcheon camping group, we had 9 total confirmed cases, and the KCDC is highly on alert as there is an increase of the risks of infections, especially during the upcoming summer holidays. And in order to enjoy a safe and relaxing summer holiday, we ask you to also travel within your family groups, and also we ask you to remember at all times the 3 do's and 3 don'ts. The 3 do's are as follows. First, wear a face mask when indoors, minimize stay time in rest areas and restaurants, and also maintain a 2-meter distance from others. And 3 don'ts include do not going outdoors if you feel sick, including when you have a fever or cough, and do not visit closed, crowded, and close contact settings, as well as enclosed spaces at busy hours, and also refrain from having physical contact and activities that increase the respiratory droplets. And we also have the Safety e-report that is run by the Ministry of Safety, and we have been receiving some reports of safety violations. And here are some updates. Throughout the past month or so, we have seen the factors of risks, and there were also, most of them were reported in regards to groups as well as club groups, and we were identified of the fact that there were many cases where they traveled in large buses without wearing the face masks, and also they dined together at basement floors, so these parties were also carried out. During the weekend, aside from the worship services at the religious centers, we ask you to refrain from going to small group meetings, and they were some of the examples that also have been reported via the Safety e-report. And there were some special group meetings for the religious groups, especially for the senior groups. And also there were the spas called 찜질방 in Korean, which also had breaches of these safety quarantine, and they did not wear face masks, and they also shouted together, and they played games together. And also there were situations where merchants at the traditional markets did not wear face masks, and these were some of the examples of the reports that have been reported on our Safety e-report application. And please remember at all times that COVID-19 spreads at closed, crowded, and close contact environments. So during the weekend, we also ask you to refrain from going to group meetings and club meetings, as well as the religious group meetings, and you need to switch them to online alternatives. And also we ask you to limit the number of participants at the services, and also keep your masks on, and please keep 2 meters of distance, and also play music instrument rather than singing, and please refrain from having group meals. And please refrain from going to closed, crowded, close contact environment, which also are the entertainment groups as entertainment facilities and multi-use facilities like PC rooms and saunas and so forth. And also we ask you to wear your face masks if you are having group meetings with your family members as well. We ask you to keep personal hygiene measures as well. Starting from tomorrow is the beginning of a new month, August, and August is a new month of summer holidays and vacation. Depending on how we can contain the virus fully will be very important in determining the risks of infection of the COVID-19, especially during autumn. So it will be a very crucial moment. And starting from the cluster infections in a metropolitan area, which also spread to Chungcheong and also Jeollanam-do province, we also were able to curb these virus spreads thanks to the participation of the members of the public. And we also ask you to enjoy and recharge during your summer holidays. However, please also remember that we need to regard this a very crucial time as a time of risks for spreading the infection. And please also take note of the camping group, which also spread the infections. If you have close contact with others, you are not prone to the virus, even if you are outdoors. Even if you do not have symptoms, the COVID-19 could also spread, and you could also infect others. And because the infectious rate is also very high, even though you don't have symptoms, it is very important and very effective to only wear face masks and keep distancing with others. So during the COVID-19 pandemic, please remember that any group meetings could be open to the risks of infection, and please remember that this could also put at risk the safety of yourself as well as your loved ones. And also please take particular note when you are going to beaches and cafes, restaurants, and other enclosed spaces. Please be vigilant and also wear your face mask and keep healthy distance. The quarantine authorities will also continue going forward. We will continue to stay vigilant. Thank you very much.
Right, that was our Chung Young, the head of KCDC, with Friday's afternoon briefing. So, do give us the gist of her briefing.
All right, well, it looks like this weekend will be a very crucial one in preventing a further spread of COVID-19 here in Korea. And that, as also Mogan earlier said, many people are going to head to their summer holiday, their vacations. And one new spot that emerged as a location where extra caution is necessary are camping facilities, as we have 9 cases related to a camping place in Gangwon-do Province's Hongcheon, and that's linked to 3 families. And that also again shows why government officials are asking for people to travel within their own family and not with other people, because that is increasing the risks of infections. Meanwhile, as for the imported cases today, we have 12 that were detected at the airports and seaports, as well as 10 that were detected locally, and most of them were from Asia, with 10 from Uzbekistan. Meanwhile, also this weekend, spectators at soccer games will be allowed again, but only 10% of the total seats. So Chung Eun-kyung noted that they should refrain from eating and chanting and shouting during those games. And also another thing, over the summer holidays, it would be the best idea to just relax at home and spend your summer vacation like that, just by staying at home and trying to prevent a further spread.
All right, thank you for that. So I will see you again next week.
See you next week.
Public facilities, including museums, art galleries and libraries here in the metropolitan area, have opened doors after roughly 2 months of closure in light of COVID-19. Our Chon Song-cho is at one such venue to tell us more about the preventative efforts there to ensure a pleasant and prudent visit amid the pandemic. Hello, Song-cho.
Good afternoon, Sunny.
Song-cho, I hear you're at a museum today.
Yes, so I'm at the National Museum of Modern and Contemporary Art, Korea, in Seoul. This is one of the 10 major art institutions that have reopened its doors to the public on Wednesday of last week. Well, they had been closed for 54 days due to COVID-19. But amid signs of a slowdown in infections, the South Korean government has given the okay for these institutions to reopen its doors to the public. Well, if you've been missing the experience of visiting these art museums in person as much as I have, then why not take a look inside and see what's on view right now? Without further delay, come follow me. So this is gallery number 1, and this particular section is called MMCA Collection Highlights 2020 Plus, and you can see all these amazing art pieces from modern times as early as 1900. So you see people wearing traditional hanbok in these drawings as well. So you might wonder why there are not that many people in this exhibition. Well, we're living in the era of COVID-19, right? And actually, I feel much more comfortable walking around this exhibition hall, because I don't have to keep worrying about social distancing and bumping elbows to elbows with other people. Well, this is all thanks to the museum's protocol to accept less people than usual. So just 200 visitors are allowed at a time for a 2-hour period. And then the number of visitors allowed is capped at 800 per day. Well, and if you're like me, one of those people who like to go on guided tours whenever you go to museums, then you can thank the mobile application, MMCA mobile application, like the one that I have downloaded on my smartphone. So as long as you have it downloaded, then you can go on it and get access to audio guides with all kinds of information, context, and details about art pieces, and to better understand the masterworks of MMCA collections. So for instance, if you want to use the audio guide, then you can go on, click Seoul, because we're in Seoul right now. There are 4 different locations. Click on artworks, and then it'll automatically connect you to whatever art piece that you're closest to. So let's see. you see all these audio guidelines playing from the application. All right, so with this technology and social distancing enhanced, well, being able to walk around the exhibition at your own pace, quietly, peacefully, is something that we all appreciate, right? And to tell us more about what the museum is exactly doing to keep visitors and staff members as safe as possible, well, we have one of the officials from the museum to tell us just that. And Ms. Yoon Seung-yeon is here with us. Hi, welcome to our show.
Hello.
All right, so for safe reopening, what plans and measures has the museum come up with so far?
Well, the museum cleaning team disinfect the museum every day frequently, such as door handles, handrails, and toilets. It's about 28 to 30 members do that every day. And the entire museum is disinfected once a week by the specialized outside company. So we are trying to maintain the museum safely every day.
Oh, I see. But to secure full safety, efforts have to be made from both sides, the host as well as visitors themselves. So what do you want to tell people who are planning to visit the museum to keep in mind?
Yes, the visitors are recommended to make online reservations at the museum's website first. Visitor numbers are limited for the social distance viewing. Basically, all visitors are required to wear a facial mask and use hand sanitizer and have their body temperature checked. And please make sure to maintain a distance of 2 meters with other people in the museum. That's it.
All right, thank you so much for your answers this afternoon. Thank you. All right, so let's face it. We are all done trying to pretend that the experience of visiting art galleries and museums in person can be fully replicated online. So it's time to reconnect yourself with your favorite art pieces and spaces in museums. However, these institutions need your cooperation and commitment more than ever before so that you can be a responsible art lover by visiting the art exhibitions while sticking to safety rules. This has been Chun Sung-Cho reporting live from MMCA Seoul, and back to you guys in the studio.
Right, Song-Cho, thank you very much for the coverage. And for those of you planning to visit the museum this weekend, do abide by the safety guidelines.
위험 요인은 여름 휴가와 방학입니다. 관광지, 유흥시설 등 고위험 시설을 중심으로 집단 발생할 위험이 있습니다.
The World Health Organization has dismissed the effect of seasonal factors on COVID-19, ruling out the likelihood of the virus weakening in the summer. Amid this scenario, Koreans begin their summer holiday with local schools poised to end their semesters in early August. Health authorities believe this upcoming period will put their containment efforts to test yet again. For more on this, I have Professor Chung Gi-seok from Hanlim University. Welcome back, Professor Chung.
Good afternoon.
And I also have Dr. Alice Hyun-kyung-tan from Ms. Medi Women's Hospital. Good to have you back, Dr. Tan.
Thank you for having me.
Professor Chung, while claiming that COVID-19 will not be affected by seasonal factors, the World Health Organization pointed to Brazil and the US as tangible examples. Now, both countries are seeing alarming surges in cases, but they're both undergoing very different seasons. How do you explain the alarming spreads in these two countries?
Yeah, there will be several reasons why, but in both countries, we can find that the politicians are leading in a wrong way. They are overwhelming specialists, particularly in healthcare and quarantine. So for example, in Brazil, the president of Brazil is reluctant to wear masks. And finally, he has contracted the COVID-19. And on top of that, even though WHO is worrying about the seasonal variation, but the Brazil is in the middle of a cold season. So the infection rate will be increasing and will be in for the time being. And in USA, we can see another political leaders giving misinformation, like not wearing mask in public, and some introducing ineffective drug like hydroxychloroquine. And on top of that, some states are too late to lock down. Some states have early eased the restriction. So that's why the increase of prevalence in that area. So as a result, we can see over 150,000 deaths in USA. The number is a huge one. The number is almost equivalent to total all-cause deaths in Korea, half an year. So it's a tragedy. So I like all the politicians, particularly in US and in other countries, to follow and the recommendation of specialists.
Right. Dr. Tan, it's not just these two countries that are reporting troubling trends. I mean, we have neighboring China that also noted more than 100 daily new infections this week. Are we in the midst of seeing a second wave, would you say?
Well, 6 months have passed since the WHO declared COVID-19 a public health emergency of international concern. And despite the fact that 6 long months have elapsed, it's disappointing that we're still seeing such high daily fatalities from countries around the world. Here in the Western Pacific region, different countries such as China, Vietnam, South Korea have used a variety of tactics to get COVID-19 under control. But the common denominator has been that the actions were swift, they were part of a national strategy, and they were decisive. Back in June, there was an outbreak in Beijing, in the Jinfadi market, and Beijing went really all out to try to control the outbreak. They tested 7 million people to discover 328 cases, and it took weeks for them to get this under control. Compared to Wuhan, of course, where there were thousands of cases, it wasn't really a wave, it was more of a ripple. However, the 100 new daily cases that are being reported out of China, and then what's going on in Vietnam, where there's been an outbreak in Da Nang, and it's particularly troubling because many of the cases that perhaps started in Da Nang, I think they've already traveled back home to other major cities around the country, and we've seen visible signs of people being more lax about social distancing in some of the major cities in Da Nang. And so what these cases and examples, even in Asia, are showing us is that globally, we are still in a rapid acceleration phase of this pandemic. We still need to be very careful. We're really not even beyond the first wave if we look at this globally.
Right. Professor Chung, what is your assessment of the situation, COVID-19 situation here in Korea?
These days, when you look at the figures, the local occurrence is quite stabilized. So there are not many local Koreans who are suffering from COVID-19. But look at the foreigners coming into Korea, including overseas Koreans coming into Korea. The numbers are increasing. So we need some strict strategy to prevent viruses influx into Korea. So for example, we can strengthen the immigration policy or sometimes strengthen the quarantine procedure. And in that sense, the government, within the government, they need to cooperate. For example, Ministry of Health, Ministry of Foreign Affairs, Ministry of Law, all together to prevent the influx of viruses.
Right. Meanwhile, a recent study by UCLA researchers, that is, shows the antibodies produced by the immune systems of mild COVID-19 patients last only a few months. For more on this finding, I have Dr. Otto Young, who led the study, live on the line. Welcome to the program, Dr. Young.
Thank you so much for inviting me.
Doctor, let's begin with you sharing with us details of your research and its findings, please.
So we examined 34 patients with mild COVID-19, and we measured their antibody levels over time, over about the first 90 days of infection. And what we found was that on average, there was a very remarkably rapid drop in antibodies against the virus.
Dr. Tan, if you have a question that you'd like to ask Dr. Yang, please go ahead.
So, Dr. Yang, thank you for joining us here in Korea. I think your study confirms or supports what Professor Long published in his study in Nature Medicine last month, specifically that like other coronavirus diseases such as SARS and MERS, people who have mild disease tend to have limited immunity after they recover. I was wondering if you could explain the significance of your findings vis-a-vis the results of community serology studies that have been going on around the world, and also specific to our country, Daegu, we had a particularly large outbreak there in March, and so 3 months have elapsed since that large outbreak. 7,000 people were affected. Do your results suggest that perhaps those thousands of people who had just mild disease may be susceptible to reinfection with COVID-19? And also, here in our country, we are actively recruiting volunteers to donate convalescent plasma. Do your research studies suggest that perhaps the timing of donation would be ideal if it occurred within 1 month of recovery of COVID-19?
Yes. So in answer to the first part of your question, which is whether people are becoming susceptible to reinfection, I mean, the first caveat to assessing our results for that question is whether or not measured antibodies correlate to protection or not. That's not always the case with all viruses, but it's a reasonable assumption that they probably do. And if that's the case, then it is very possible that people, especially people with milder infection, will become susceptible again, which is very worrisome because those are the major spreaders of the disease, right? The people that have milder infection and are circulating in the community. And regards to your second question about plasma donation, I think that depends. So even people that are mildly symptomatic actually have very varying levels of antibodies. So some have much higher than others. And certainly people that have more severe disease have much higher levels overall. So I think it needs to be tailored. It's not necessarily time, but it's how much antibodies the person has at that given time. But it does highlight that it probably is important to continue monitoring. So here at UCLA, we also are doing convalescent plasma therapy. And the blood bank here now is doing serial monitoring to make sure that their donors, when they come back, still have high levels of antibodies.
Dr. Yang, simply put, your study shows that immunity to COVID-19 among those who experienced mild cases is basically short-lived. What impact does your finding look to have on efforts to develop a vaccine or a cure?
Yeah, that's a really interesting question. So it depends on whether or not the vaccine behaves the same way as natural infection, right? So with a vaccine, it may not be exactly the same, and that could work both in favor or disfavor of a vaccine. So working in favor of a vaccine is that these are fairly mild infections, and these are people who had a short duration of illness. So perhaps if the immune system had more time and more exposure, they could reach higher levels. And that's certainly what's suggested by patients with more severe disease who have higher levels of antibodies. So potentially with the vaccine, you could overcome this issue by giving multiple doses. Another thing that's potentially possibly in favor of a vaccine is that many viruses will use mechanisms that they have evolved to reduce the immune response, right? Because that is a way for the virus to improve its persistence. So if this virus does something like that, then it's possible that a vaccine, which is not the whole virus causing a whole infection, would be an advantage in terms of the immune system not being disadvantaged by actual viral infection. But on the other hand, it is also possible that a vaccine won't achieve as high levels of antibodies as natural infection. And it is also possible it will behave the same way and be fairly short-lived. We'll just have to find out.
I see, only time will tell then. All right, Dr. Yang, thank you very much for sharing your thoughts with us live at this hour.
It's my pleasure. Thank you very much.
Professor Chong, given the recent findings by Dr. Yang, would it be practical to assume then that the ultimate vaccines against COVID-19 would not generate lifelong immunity against the virus?
Yeah, I don't think any kind of vaccine will give us lifelong immunity. Particularly according to data released so far, even from the Moderna vaccine, it needs 2 times consecutive vaccination, not just 1 time like a flu vaccine. So, but another information says that there some companies developed just 1-time vaccine which lasts months. So anyway, I don't think there in near future we will have effective and safe vaccine so far. And also, if the COVID-19 is all year round infection, which WHO suggested, maybe the risky population like elderly people or people with diabetes, hypertension, chronic lung disease should have get a vaccination multiple times through a year. But the information also says that there are more than 140 vaccine candidates under developing throughout the world. So we are expecting a more effective and more safe vaccine in the distant future.
Right. Yes, Dr. Dan, as Professor Chong just mentioned, the global race for a vaccine is on. And amid this scenario, what price range do you believe would be appropriate for a COVID-19 vaccine in the future?
Rather than price point, I think prioritization of whom should receive the vaccine first once it becomes available is the more important issue when it comes to COVID-19. And calculation of the cost of the vaccine, what's an appropriate cost to the consumer and what's the cost to nations because they are, trying to secure doses of vaccine in advance. This is very complicated because of the extraordinary circumstances under which vaccine development is taking place. We're in the midst of the worst pandemic of the century. Vaccine is being developed at an ultra-fast pace using new technologies that have never been used before. And also, millions of dollars have already been donated to support the development of vaccines. So in terms of calculating the cost, it's going to be very complicated. Whatever the cost ends up being, some people are saying maybe around 35,000 Korean won per dose, we're not sure. I would not be surprised if the South Korean government fully subsidized vaccination, especially for frontline healthcare workers and for people who are at highest risk of developing death and severe disease, namely people over 65 years of age and those with comorbidities. Because at the end of the day, the cost to provide vaccines for free, I think, will be a very small price to pay compared to the cost of operating this country under pandemic conditions. So we'll see what it ends up being.
Right. And given this scenario, Professor Chong, since we do not have a vaccine nor a cure, prevention appears to be the best alternative, since it's better than cure, as most would say. Despite this reality, we have had cases of foreigners in Korea in self-quarantine who have chosen to flee these quarantine facilities. Speaking within your capacity as the former KCDC head, what measures would you recommend to ensure better management of foreign nationals in Korea at self-quarantine facilities?
Yes, we all know that just one single patient can transmit the disease to many people and in a very rapid manner. So we need to strengthen the monitoring system. We need all the confirmed cases, the close contact under quarantine control. So we need to strengthen quarantine patient and also the close contact as well. So in other meaning is we need to restrict the visa issuing or some imposing a hospital bill for foreigners because some foreigners consider Korea as a COVID shelter. So we need mutual understanding between the countries.
Right. Finally, Dr. Tan, the summer vacation is here. We've been talking about it at the start of the program. Speaking as an expert, a medical expert, what words of advice would you give for those choosing to take their vacation plans outside of their homes? What should they do? What should they not do? And what are some places they should avoid?
Well, we talked about the 3 do's and the 3 don'ts, right? So the 3 do's are mask, hands, and distance. So wear a mask if you're indoors. Make sure you don't touch the outside surface of the mask. Wash your hands before and after donning and doffing the mask. Wash your hands frequently and use hand sanitizer. Keep a safe distance, especially if you are in a place where you're around people that you don't know. And then 3 don'ts. Don't leave home if you feel sick. Don't go to places that are crowded and enclosed. And don't touch your nose, mouth, or eyes with unclean hands. In terms of where to go, outdoors is better than indoors. And this is not the time to go to popular or highly recommended sites. I think going to remote, quiet places is the way to spend this holiday season.
Places that are less crowded and less confined then. All right, Dr. Dan, as always, thank you for your thoughts. And Professor Chung, thank you for being with us today.
Thank you for having me.
Right, well, that brings us to the end of this week's edition of COVID-19. Cluster infections here in the metropolitan area remain a source of concern among health officials. So do abide by safety precautions when choosing to venture outdoors. Have a safe weekend and see you next Monday.